Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Let's talk about what the experts are calling a breakthrough and the next chapter in organ transplantation using cells instead of donor organs. Stem cell therapy, also known as regenerative medicine, is used to heal tissues and organs and restore function lost due to aging, disease, damage, or defects. Stem cells are the body's raw materials from which all other cells with specialized functions are generated. Let's find out more about regenerative medicine and its use in disease management with my guest, a US-based board-certified internist and regenerative medicine specialist. He's also the medical director of Glory Wellness Center and Weight Loss Clinic. Dr. David Ikudayisi is here in the studio with me. You are welcome to the show.
Thank you very much for having me.
Okay, so it's been established that stem cells come from one's own body.
Correct.
But where exactly in the body do they get them from? I'll explain why I'm asking.
Okay.
I know that if we're going to do a bone marrow transplantation for sickle cell disease, for example, the raw material is gotten from the bone marrow. Okay, so where do you get stem cells from? Is it also the bone marrow?
There are four common sources for adult stem cell therapy.
Which is what we're handling today.
That is correct. And actually, before I even explain a little bit about adult, the sources are your fat in your stomach or waistline, your bone marrow, like you mentioned earlier. Those are the two that are from you. The medical people call it autologous.
Okay.
We also have two allogenic sources, that is from someone else. First of the two will be umbilical cord stem cells.
I can see already that will be a no-no, especially in this country.
Well, for maybe religious reasons
Definitely.
or for belief, whereby we bury the placenta under the tree,
exactly.
or things like that. But in Western developed countries, that is what they use. Even nowadays, it's very common that when a woman is giving birth, they ask her, do you want us to save sample of your baby's cord blood? You know, so, I mean, you and I, we cannot use our own umbilical cord stem cells. But for the young ones now, 25 years from today, they can use their own. So instead of allogenic, it will now be autologous, that is their own cells.
Yeah.
So the fourth source of adult stem cells will be exosomes, exosomes. And most cells in the body produce exosomes. They are tiny vesicles from a cell. And it can be from bone marrow, it can be from placenta. Okay,
so these cells are applied to heal one's own body of disease. What kind of procedure is this? Does it involve surgery?
It depends. Even the surgery that is involved is kind of minimally or non-invasive. So if you are using the allogenic, so that's the exosomes and the umbilical cord, in that case, by the time it makes it to the doctor's hand, it's already ready to go, preserved. So all you just need to do is transplant it or inject it locally to wherever it needs it.
An injection?
Yes. It can be injected into the joints, for example.
Okay, you're making this sound way too easy. They prepare these cells.
Yes.
And then maybe there's a joint problem somewhere.
Yes.
And just inject it into the joint and it heals him.
That is correct.
These are cells. Let's just say...
Sorry, before, I didn't mean to cut you. For those that are waiting for the other part of the answer about the surgery. The other two that are from you. So the way to get that is to do it in a minimally or non-invasive way using small cannula to take the fat from your stomach so that the cells are not damaged. Then those cells are processed and then transplanted back to you. And then the bone marrow is also, they can get it depending on the age, you know, from the bone. In adults, it's mainly from the hip or waistline bone. And in children, they are many other sources. Once the bone marrows are collected, they are being processed and then ready for transplantation.
Okay, let's talk a bit about this processing, because this cell comes from the person's body.
That's correct.
Why doesn't it heal him before it's brought out and processed? What's done to it?
Okay. The way we are all created is to heal ourselves. And that's what we do every day. You go to a salon, you cut your hair, it grows back. You mistakenly cut yourself in the kitchen while cooking.
It heals.
Within 5 days or so, it heals. So this is ongoing process. The problem is that the healing rate, especially in adult, is slower than the degenerative process, than the damaging rate. So by now processing these stem cells, having them easily available to flow around. So what you are technically doing is increasing the number of available stem cells in the body. So you accelerate the healing process.
Okay, so we get that now. It has to be processed before it's put back for the person to heal.
Correct.
Now, when people receive donations of body parts or blood, there are sometimes some reactions or outright rejection of the part. But in this case, you use the patient's body.
Yes.
Do you ever come across any adverse reactions, any rejection?
I've never, and that's why they call it autologous. It's your own body part. A simple way to understand that would be like somebody punch you on the face, you have a black eye or swelling, that's your blood and cells collecting there. Over time, the body what?
Reabsorbs it.
Or even simpler one, or everybody may relate to this, is hemodialysis. To clean up a patient with a kidney problem, the blood leaves their body, go to the machine, then it comes back to their body. So that is why it is.
So no chance of rejection there.
Almost to zero.
Okay. So when we talk about adult stem cells, I think of age. Is there a problem with the cells? Are they do they have limitations because it's an adult stem cell?
Okay. Now, first of all, to clarify the word adult in adult stem cell therapy, the adult is not about age. It's about fully formed human. Because under adult stem cell therapy, we have the use of umbilical cord, which is nearly born baby. Why do they choose the word adult? Because there are 3 types of stem cell therapy. The first one is embryonic stem cell therapy. That was the first one that made it to the news, very popular. But at the same time, there's an ethical issue with it. So most countries do not allow it, and religious groups don't allow it. Even in USA, only certain centers deal with embryonic stem cells.
Definitely.
And why? Because what they use is embryos from IVF clinics. These are potential babies. Human beings.
That would cause a problem.
So messing with that is considered unethical. But they are very powerful. They have a pluripotent power or characteristics. And that leads to the second type. It's called induced pluripotent stem cell therapy. In other words, we want that powerful effect of embryonic, but without actually using
the embryonic thing.
So the induced pluripotent stem cells, that's when you take your skin, white blood cells, you reprogram them, you culture them, and then you try to, make them do what they're supposed to do. But initially, those ones were still considered not safe. But it's about 2 years ago now, they've already started a clinical trial in human being, with natural killer cells, white blood cells that have been reprogrammed to target cancers. So the third one, which is clinically safe, it is clinically available, it's called adult stem cell therapy. Like I said earlier, that involves bone marrow, fat, umbilical cord from newly born baby, and then exosomes, which could be from placenta or other sources.
Who is eligible for stem cell therapy? Can anybody go through it? Do you have like a checklist? Oh, sorry, sir, you are not eligible for stem cell therapy because of such a condition or such a thing?
Yes. There's limitation to candidates. It's just that it is even easier to mention who cannot get it than giving the list of who can get it.
Is this according to the person or according to the disease?
Well, it's according to the disease.
Aha, we are getting somewhere. Now, I heard that this thing can solve problems of stroke.
Oh, yes.
People who cannot talk anymore because they've had a stroke.
Yes.
And cannot move anymore because they've had a stroke. Do tell.
Well, you know, in stroke, we say time is brain. The earlier, the better. And we also say the time is of essence in regenerative medicine. Let's take stroke. When there's a compromise, there's disruption of blood flow to the brain.
Yes. And we have a video there. I think that's a stroke patient.
Okay, yes. That's one of the patients treated in Nigeria who has a 2-year-old stroke. You can see it's moving right while on the table. So 2 years earlier, he had a stroke, very big one on the brain, and he couldn't talk, he couldn't move. He was wheelchair bound for 2 years. But the earlier part of what the viewer was seeing, this patient couldn't move, but immediately after treatment, while still on the treatment table, he started moving. And his hand that was the right hand, he made a fist, firm, he couldn't open it. Now the fingers are pretty much open. He's raising it by himself, and this is after the second treatment. As of today, by 3 months after the first treatment, he's already walking around without assistance, using a cane. Before the treatment, that's the same working at our center.
Okay.
Before the treatment, he was wheelchair bound. He couldn't walk. He couldn't talk. And 17 days into the treatment, he started saying words that he never said in 18 months, according to the brother.
Wow. So where you put the stem cells to work in the body, does it depend on the disease? Because you have me wondering, where did you put those regenerative cells? Did you inject them into his chest or his brain, or, what happened?
The standard training protocol is to do, we call it intravenous. So, because one thing about stem cell therapy is this: anywhere blood, by the way, if I say stem cell therapy, I mean adult stem cell therapy, because the other two are not clinically available. So when you transplant it through the vein, anywhere blood supply reaches, stem cell will reach there. They get attracted, like home effect, towards damaged, inflamed, degenerated tissues. So there are signal on bad cells in the body that attract or signal to the signal on the stem cells. So they now migrate to that area and tell the cells in that area to start multiplying, differentiating.
So what you're saying is that if a patient had, for example, a multiple problem, multifaceted problem, stem cells will go all around to all those places.
That is correct.
Wow. Okay, let's quickly take a break before we continue. We're going on a short break. Please stay with us for the rest of it. Welcome back. It's Health Matters, and we're talking about regenerative medicine. If you have questions on this topic, please call 0808-054-2233. You can also send a message on X, I believe it is, formerly Twitter, at CTV_Mary A, or just send email to moalale@channelstv.com. Dr. Ikudayisi, you were talking about these, what do you call them, by the way, when you've treated them and everything and harvested them and treated them? What do you call that component?
Okay. If it's from the fat, from the fat from the stomach, we call it SVF. stroma.
Okay, so they've got different names. Well, okay, this component with the regenerative power.
Or let me say mesenchymal stem cells. That is across the board, whether it's bone marrow fat.
That's a mouthful. Anyway. Mesenchymal. Yes, we all know what we are talking about. You put it in the body, and you said it's attracted to deceased areas.
That is correct.
Where blood is not flowing, right?
No, anywhere blood supply reaches.
Okay.
The stem cell flows. It wants to transplant it through the vein. The blood, the circulatory system in the body supply almost pretty much all organs.
That's right.
In the body. So these stem cells too will flow around. Now, when they travel, there's nothing wrong with an organ. Nothing happens. But most of the time, they get attracted to the damaged, inflamed tissue organ. So those organs will now start repairing themselves, regenerating themselves faster than they were on their own.
Okay.
So if somebody comes in for, like the patient that we showed earlier, came in for stroke. He has diabetes.
Okay.
He also has a chronic kidney disease that is already at borderline of stage 3B and 3A. So a couple of weeks later, let me just say, even at 2 months, is a hemoglobin A1C, which is a test that is similar to the daily finger stick prick, but this one is measured like 3-4 months interval. It already came down.
So he was already healing?
Normal, yes, to top normal range. The kidney function went from borderline 3A, 3B to 3A, and now to stage 2. The lower the number, the better the
condition. So he's going to get to a stage where he doesn't need dialysis?
Oh, he's already reversed himself.
Wow.
Because before, he was going towards dialysis. Stage 1, stage 2, stage 3A, 3B, stage 4.
If he's got into dialysis, can he be recovered?
That is still kind of challenging. But what has been able to achieve, like among our patients, is some of them got off blood pressure, medication. They've been on dialysis for 15 years. They stopped getting blood transfusion. They stopped getting the epogen, like the injection that makes the kidney to stimulate production of red blood cells. So they stopped all those things. And then talking about that, if somebody is getting a kidney transplant and they do get adult stem cell therapy prior to that, you are talking about rejection. The risk of rejection of that new organ is reduced.
Oh, okay.
So they make the body even ready. They modulate the immune system. They make the body ready to accept that organ that's going to be transplanted. So the person has a better chance of success.
Can this translate to recovery of memory in cases of Alzheimer's, in cases of dementia? But before you answer that, we have a call from Chidima. Hello, Chidima.
Hello, ma. Good afternoon, ma.
Good afternoon. What question do you have for the doctor?
Yes, I want to know if there is any side effect for a stroke patient to have sex with his wife.
Okay, that doesn't have a lot to do with regenerative medicine, but I'm sure probably after being regenerated, he'll be good as new.
Primo, that is correct. Actually, talking about that in men, when they are being transplanted adult stem cells, and like I told you earlier, it doesn't know the diagnosis, so it kind of flow around. We have some of our patients that are male. 3 months later, how's your sexual life? We never treated the private part. I mean, there's a treatment for that.
Anything to do with intimacy and all that.
We didn't do that. But because of the improvement in the production of testosterone, because this stem cell goes everywhere, their sexual life significantly improved.
But before they are healed, I'm sure they have challenges in those areas.
That is correct.
To answer Chidima's question. All right. So we were talking about memory.
Yes. There are different types of memory. There's Alzheimer's, there are different types of memory problem, which is different types of...
Yes, you spoke of vascular dementia.
Yes, different types of dementia. So there is Alzheimer's dementia, there's vascular dementia. So both of them, they do get response. Even the vascular dementia respond better because most of those vascular dementia are caused by many tiny strokes that was not big enough to show symptoms.
Yes.
So over time with age, you have multiple damage spots on the brain that is also affecting the memory center.
Just let's hang on a little. We have Ifeanyi on the line. Hello, Ifeanyi.
I want to know the effect of Fabrum, which is an herbal drink that is stem cells that people take on an empty stomach in the morning 2 hours before you eat, and at night 2 hours before you go to sleep. Since it's a herbal drink, I want to know the effect, how it works, how effective it is.
Thank you.
Since it's not being injected.
So she's mentioning a herbal drink of stem cells.
Yes,
enlighten us, please.
All right. First of all, we need to understand what is a stem cell. A stem cell is any cell that can multiply and keep multiplying and at one point start differentiating into different organs. There is no plant or herbal drink that can turn into your kidney, your liver, or whatever. So let's get that straight.
So now, some people, correct me if I'm wrong, are already abusing
the name
stem cells
for their products
and getting people to drink stuff in the name of stem cells.
That is correct.
Okay.
See, for human being, for any cells or tissue in our body to survive, it has to be preserved. That's why somebody cut their finger by mistake. You keep it in ice and rush it to the hospital.
That's right.
So you cannot have a true stem cells in tablet form or powder form or in drink. Yes, those are some of those things are plant-based, like you say, herbal stuff, and then plant stem cells is different from human stem cells. I understand many companies understand the future of medicine and are using that name. So that is not the right. If I'm talking about other stem cells, that is not what she's drinking.
Okay. So there you have it.
But I need to make another point.
We're actually out of time now, but we can always explore this some other time. Right. You have it there. Stem cells cannot be inside a bottle, not the kind of stem cells we're talking about anyway. So thank you so much for your call, Ifeanyi, and thank you for staying there with us and letting us be a part of your day. Have a wonderful day. I am Mary Alale Yusuf.